It's time to take 5. Now you know.
We're visiting Good Samaritan Medical Center, a Palm Beach Health Network hospital. Today we're speaking with neurosurgeon Dr. Tim Burke about stereotactic guidance for brain surgery. Dr. Burke, you are a board-certified neurosurgeon. What types of conditions do you treat?
We treat a variety of different conditions of the nervous system involving both the brain and the spine, and that can involve degenerative issues around the spine, things like disc herniation, spinal stenosis, and we also have a particular focus on dealing with brain or intracranial disorders, including brain tumors, other disorders, intracerebral hemorrhages, Chiari malformations, pituitary tumors, skull-base tumors.
Tell us about stereotactic guidance in brain surgery and the conditions that this type of surgery treats.
Stereotactic surgery or stereotactic guidance is a technology that I like to refer to as GPS for the brain. It works very similar in providing a map that we reference during surgery, just as you would reference it in your car when driving to a particular location. It allows us to have real-time access to the pictures, CTs, MRI scans, and reference the normal and abnormal structures at the time that we're doing surgery.
How is this type of surgery performed?
This surgery is done with a set of images that are obtained either before surgery or actually during surgery itself in the operating room. These are uploaded into a very advanced computer system, and we utilize invisible infrared light that shines out through a set of cameras, very much like you would have satellites up in the sky, and this is reflected off of reference points that are attached to the patient and our surgical instruments that are coated with very, very small microscopic beads of glass. We are allowed to then see the images in real time during the surgery, both on a screen and even sometimes actually directly within our surgical microscopes.
What are the benefits of stereotactic guidance over other brain tumor surgeries?
Using stereotactic guidance has probably been one of the largest advances in the field of neurosurgery in the past many decades. It provides for us to do the surgery safer, which is the primary goal, more effectively, and it allows for smaller incisions, smaller surgeries, and quicker recovery.
Many conditions, if left untreated, can become increasingly painful and even dangerous. What advice do you have for patients who may have neurological symptoms but are delaying care out of fear of coming to the hospital?
It always makes sense to treat these disorders sooner and get evaluated sooner rather than later. And this can involve consulting your primary care physician right away and see if imaging studies are necessary. A referral to a neurosurgeon should also be followed up on very early, because we know that when patients get treated early, their outcomes, how well they do after treatment or surgery, tend to be better.
Why should a patient choose Good Samaritan Medical Center?
Well, at Good Samaritan Medical Center, we have developed a neurosurgical team that involves the operating room. So this includes our operating room techs, our nurses, our anesthesiologists, our critical care teams afterwards when patients do need to go to the ICU, which is not unusual with neurosurgery, and also our floor nurses that are specialized in the care of these types of patients.
Why is it important, especially now, for patients to take care of their health? What are the consequences of putting off surgery?
If elective surgery is necessary and it's put off, unfortunately these can sometimes then turn into emergent procedures. And this is a more dangerous situation. Most people realize that when they're scheduled for elective surgery, they may go to their primary care doctor, they get evaluated, they get tests done, they may be sent to a cardiologist or a lung specialist to make sure that surgery is safe to be performed. When emergency surgery is needed, we don't always have the luxury of doing those evaluations beforehand, and it can mean that the surgery is more risky for the patient.
At Good Samaritan Medical Center, patients are allowed and encouraged to have one visitor per day when they're admitted. How important is this for patients?
We find that when patients have a coach, a lot of times they refer to it as with them, there's a huge amount of benefits. First off, it provides an extra set of ears. We know that when people listen to a physician, as much as we like to think that they hear everything that we say, it's estimated that the first conversation when someone is met with a major medical disorder, they assimilate only about 10% of that information. So simply just having another person listening is very helpful. It also provides a calming force to patients, and sometimes patients may need a motivating force also, and it accomplishes that quite successfully.
Thank you, doctor, for all of this helpful information. We hope everyone understands how important it is to take care of your health, and if you need surgery, please don't hesitate to go to the hospital. The doctors, nurses, and staff at Good Samaritan Medical Center are there to keep you healthy and safe.